week, Dr. Olawale Oladubu shared his expertise on the country's health sector in the last 65 years. This week, we bring you the concluding part. Please stay tuned. Majority of the citizens still experience out-of-pocket spending. What should government be doing now to reduce this and to bring more people under the insurance plan?
Yes, one of the ratings of a good healthcare system is universal health coverage. And where health is available, it is accessible, it is acceptable and affordable, to everyone, irrespective of geographical location, irrespective of economic standing, and irrespective of gender. So if we are able to do this, then I'm sure 90% of our health care concern in the country will have been addressed. So, and one of the ways this can be done, or the major way it can be done, is through health insurance. Nigeria adopted health insurance in the year 2005 when this National Health Insurance Scheme, as it was known then, was created. And between then and now, 20 years down the line, it's still unfortunate that the uptake, and the coverage is has not gone beyond 20% in 20 years. That is not good enough. So major healthcare expenses are still not out of pocket. People still cannot afford their health system. People still die because of financial constraints. It is still that bad. So for a responsible government and for this government to sustain the tempo that it has created, this healthcare system journey, I think we need to do more, and then that they should also build that political will. Initially, they started with the federal government civil servants. They were the first set of people that were onboarded, and I think we should have moved, far beyond that. That healthcare insurance should have been compulsory by now in all states of the federation, and then people and state governors or state government should not pay lip service, to health insurance. They should complement what is being done at the federal level. So if we have then private health management organizations too should be encouraged to come in. So public-private partnership is key at this point. The political will of government is also germane at this point.
All right, thank you so much, Dr. Oladubu. Let us look at tech, utilizing tech, uptake of tech to enhance healthcare systems. Should the government go fully into fintech to accelerate the healthcare system, or we should just stick with hybrid? Because I know most organizations, especially private, are into telemedicine now.
Okay. Yes, when it comes to technology in healthcare, it can never be overemphasized. And then in terms of rating, I think Nigeria is still very, very far behind. But there is a lot we can do with technology to improve our rating and our ranking, in the community of nations worldwide. Number one is that technology would help us because there are a lot of lapses that only technology can address. Number one is what we call the health information system. Okay, this can only be made functional through technology. So our health surveillance will be improved, disease control will be improved, such that through technology you can know if there is an outbreak somewhere, or you can even predict an outbreak of epidemic that has not even come to that has not fluctuated. So it helps us to be proactive, and then to our preparedness, for emergencies and the epidemics. It will really help. They will be able to also be able to rate, our system by what we call the personal health information system, where people can, upload or talk about their health, whether it is improving, talk about health promotion, talk about their health rating. They will even be able to rate healthcare facilities, wherever. So it will really help us. Then telemedicine, as it were, so that places that are far to reach, for example, no matter how much you try, if you have rural areas where there are no lights, there are no potable water, there is no good transportation, it will be difficult to attract and retain healthcare professionals in such places, But with telemedicine, it can help the far to reach, then it can, wherever you are, especially with specialists, we have a dearth of specialists, around us, and then with this JAPA syndrome as well. So, but with telemedicine, people can be reached easily, patients can reach their healthcare providers wherever they may be, easily. So then technology will also help us to in diagnosis, So early diagnosis of diseases, and as we know that early diagnosis is very key in the management of diseases.
All right. Do you think people in the hard-to-reach population would benefit from health tech, telemedicine, because already they are at a disadvantage?
Yes, but with the right infrastructures, if they are put in place, so even if it is not available to every home, to every household, but in such places, you can have a centralized, center where this technology can be accessed. So, for example, you can have a community center where there will be Wi-Fi, where there will be alternative source of electricity, there, so that people can go there and then they can access, this facility. So even if they cannot get to every home, but at least we can have centralized places like that where people in that community can access technology.
All right, 2.5 million children are still at risk of acute malnutrition. Should we be experiencing this at this time, and what is the way forward?
Okay, so it's very unfortunate that that is the story of Nigeria at this time. But as I said, that once there is a will, there is always a way. So the political will of government is going to play a major role at this point. I remember that during the last dispensation, there was this feeding the school children program. Where government committed a lot of money and then resources into ensuring that at least every school child gets at least one meal, a day. So, and they can extend that to preschool children, neonates, infants, preschool age, to see a way where how they can also be fed, And then there's this program on micronutrient supply, okay? So trace elements or things that cannot really be getting, we cannot get enough of it from our daily food. So government can also, just like they do immunization, they go from house to house to immunize, they can also do a supply of micronutrients to children, especially those who are vulnerable. So political will of government, finance in this regard is going to play a major role in addressing that.
All right, 65 years after, many Nigerians are still having distrust, holding myths and misconceptions about vaccinations and some newly introduced vaccines. What should the government be doing now to change this narrative?
Yes, what government can do majorly is public enlightenment, and then education, mass education of the populace, such that they can have they can change their mentality, that negative mentality that they have, for vaccination. So public enlightenment is key, and then the availability of those vaccines, especially indigenously produced vaccines, because I can tell you for free that many of these vaccines too may not really be tailored to our own environment. They may not be tailored to our own demography. They may not be tailored to our own genetic makeup, as a country. So, but by the time we have our own that has gone through studies, that has gone through research, and we have found that it's really, supportive of our own peculiarities, then I think it will be a good thing. So, as I said, that public enlightenment is key, and then making sure that we have our own indigenous production of vaccines.
I was going to ask, you brought the question out of my lips. Do you think if we have locally grown vaccines, the distrust would not be there. Many people would accept these vaccines. Do you think so?
Yes, yes, I think so, because it will be clear. Do you know that one of the myths that support this negative mentality is that they believe that those vaccines that were being imported, or that were being donated, to the country was ill-conceived. Many people think that it is a scheme of the Western world, to depopulate Africa. That's one of the myths. But when they know that this is indigenously produced, it will also eradicate such misconception.
All
Very
right,
well.
let's quickly look at cut in healthcare fund. Nigeria is yet to get over the cut in healthcare funding or financing from major donors abroad globally. What do you think the government should start doing now to come over this?
Okay, yes. Getting support or funding from donor agencies, international donor agencies from other countries. Well, it was good at the point, at some point, where there was a paucity of fund, as a nation to support all of that. But we should also be mindful of the fact that these countries that also do that donation, it's not really out of goodwill, so to speak, but it's because they also understand their own vulnerability, that if African nations are sick, if they are being ravaged with infectious diseases, they are also at risk, because an epidemic, in one country just takes one flight, to another country for it to get established at another place. So in order for them to curb it, to the point of origin, as it were, that's why they give all these donations to support our own healthcare system. But I think Nigeria has come of age. We should also be a country that's donating, to other countries, especially sister countries in Africa. So, because if we continue to rely on those donations, then our own ingenuity to be self-reliant will also not be there. As they say, that necessity is the mother of invention. So if we continue to rely on those donations, then we'll become complacent, we become comfortable, and we'll also not bring up our own resilience into building our own healthcare system, homegrown by our own resources.
A major issue on the front burner now is the introduction of GMOs. Do you think it is ethically right to alternate the genes of some products? And what should the government be doing now to make sure these products are actually restricted and following a guideline or censored?
Okay, yes, for me, I think for us to have food security and to be self-sufficient in our food production, GMO may be an option to consider. However, I would also advocate for biotechnology that's also homegrown, rather than importing, GMO seeds, from other clients, to be used here. Number one is that those seeds, that were generated or that were synthesized in other clients may not really be adaptable here, or they may even be injurious to our own soil composition, as it were. So for us, if you have to, and then we should also make sure that it is adaptable to our own genetic makeup. So what is good for the goose at times will not be good for the gander. So they have done their own biotechnology, those in the Western world, to support their own genetic makeup, to support their own soil composition. So, and those ones may not support our own, peculiarities down here. Talking about the soil, talking about the nutrients, talking about our own genetic people. So, if you are looking at GMO, may not really be a bad idea to support our food security, but then we should do our own research and then get something that will be good for us.
All right, as we wrap up now, your final words.
Yes, once again, I want to congratulate Nigerians on this 65th independence anniversary. And then I also want to say that the challenges of our health system, they abound. But if we take, those little steps, yes, the journey of 1,000 miles starts with a step. So those little steps over time, if we're able to sustain them, I can tell you that in no time, we'll be able to come back to the glorious day of good health outcomes, good health indices in Nigeria. So government has a role to play. The private also have a role to play. And I will talk about when we had COVID, all hands were on deck. Government were making policies. Nobody knew that we could, even in the sense of 1 week, have a oxygen production, centers in the country in the space of 1. So we had our isolation centers, and look at the outcome. Then the private sectors, you can see people coming to produce face masks, produce hand sanitizer at that time. So it was really, really good, and that was why and how we were able to weather the storm, at that time. So if we're able to relieve that and sustain it once again, the public doing their part, the private, investors, entrepreneurs also doing their part, and then us having a good and well-motivated workforce. I think in the space of 5-6 years, the story will change, and they will be able to reverse the medical tourism out of the country and make Nigeria a destination of medical tourism. Then the brain drain can now be adopted to become brain gain for Nigeria. Thank you.
All right, a journey of 1,000 miles begins with a step. Are we ready to weather this storm, weather the challenges that will be experienced during this journey? Collective efforts from the public sector as well as the private sector will sustain this health sector. Dr. Olawale Oladubu, physician, medical scientist, and healthcare administrator, thank you so much for your time on reviewing the country's health sector in the last 65 years.
Thank you for having me.
You are most welcome. Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television, and we have been reviewing the health sector in the last 65 years. A healthy sector means a healthy and thriving nation. We all require the collective effort to put the health sector in a sustainable form. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you would like us to treat, please send SMS to 00358266603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.